anybody. Anyway, my name is Professor Cathy Hill, and I'm a professor of children's sleep medicine here in the University of Southampton and at Southampton Children's Hospital. And I'm co-leading this research programme, which we're going to tell you all about in a minute. So I'm going to hand over to my colleague, Professor Cortese.
Hi, good morning, everyone. Yes, I'm Sam Cortese. I am a professor of child and adolescent psychiatry and also a consultant child adolescent psychiatrist in CAMHS in Southampton. And I have the pleasure to co-lead this program with Professor Hill and all our team.
Thank you, Sam. Kate?
Hi everyone, I'm Kate Greenwell. I'm a health psychologist at the University of Southampton, and I am the programme manager for the DISCA study. And it's great to meet with you all, and I look forward to this webinar.
Sam too, I should say. But you're muted there, you're too well behaved.
Hello everyone, I'm Sam Hornsey. I'm a researcher at the University of Southampton and on the DISCA study too, but my background's in health psychology as well.
Thank you. And last but not least, Heather.
Morning everybody. I'm the patient and public involvement and engagement lead jointly on this study with another colleague, and I work at UHS, the University Hospital Southampton. I'm delighted to see you all this morning.
Wonderful, thank you, Heather. Okay, so I'm sure you're all Zoom aficionados. For those of you who are not, we are hoping to sort of hear from you in various ways during this presentation. If you're not familiar with Zoom, if you have a look at your toolbar, you'll notice there's something called the chat function, a little speech bubble that says chat underneath it. And if you click on that, you can actually type into the message box. And what would be really lovely for us, we haven't got time unfortunately for you to all introduce yourselves, but what would be great would be if you could perhaps just pop in the chat function what your background is, why you're here. Are you here as a parent, a carer, a researcher, a professional, somebody with an interest? It just would be really nice for us to see who you are. So if you feel happy to do that, that would be great. And we'll just keep an eye on the chat and see what you have to say. Hi, Dan. Dan's a parent. I think you were the first to put your video on. Okay, lovely. So we've got somebody who's actually a university employee, but also a parent. Somebody from the University Hospital, Joshua, hello. And Dom has a PPI interest and 3 teenage boys, 2 of whom have ADHD. So you're living this. Lovely, quite a few parents, that's fantastic. So Hannah, Victoria and Catherine, you're all parents of children with ADHD, that's great. Okay, so we've got quite a few local people who also happen to be parents. That's wonderful. Okay, lovely. Thank you. That's great. I'm delighted that we've attracted a sort of mixture of people, and there's a lot of, we've got about 40 people registered who aren't actually coming today, who will be seeing the video afterwards. So that's lovely. That's a really lovely, rich group. Thank you. So I'll just talk through the aims. You are all welcome, and we've already said that, hopefully. The aims of the webinar today, what are we hoping to cover? Well, primarily we want to introduce you to our research programme with a little bit of background about what's motivating us to do this piece of work, who's involved both here in Southampton and around the country, and a little bit of detail about what we're planning to do and when we're planning to do it. And really, really importantly, speaking to you about how you can be involved if you're interested. And that's an involvement to help shape this work, as potentially participants of the research, but also as people who help us to steer the research in the right direction. And Heather's going to give us a lot more information about that later. What we can't do today, much as we'd love to, is to give you solutions. Obviously, the whole point of this research is to develop helpful solutions for families, but that's not going to be the purpose of the webinar today. But hopefully we'll give you lots of really positive ways that you can be involved in this work. First of all, we're going to talk a little bit about why, and you've already all beautifully illustrated the why from your own sort of lived perspectives, but from the point of view of research and what we know, what is it that's motivating us to do this piece of work? And it's always interesting, isn't it, to go back in history and just have a look at the date. This was a quote from an academic publication in 1957. Generally, the parents of hyperkinetic children are so desperate over night problems that the daytime ones pale into insignificance. So nothing's new, is it? Nothing's new in life or research. And it's interesting to reflect, you know, all of this time, what, almost 65 years now has passed, but how much further on are we in terms of actually fixing those sleep problems? Not as far on as we'd like to be, and that's very much why we're doing this piece of work. So, what does the research tell us? So the research tells us that around 3% of children in the UK have ADHD. So that's an important starting point. This is a prevalent problem. And of those children, up to about 70% have a sleep problem. So a significant majority of children have sleep problems as part and parcel of their ADHD. And there are actually many different reasons why children might not sleep. But amongst those reasons, the commonest is something we call chronic insomnia. And when you hear what that is, you might say, well, that's a little bit obvious, but this is what it is. So it's problems settling to sleep. So the child that simply can't switch off, or the child that's very resistant about bedtime and perhaps might have behavioral challenges at that time of night, the child that wakes frequently during the night. And that can be incredibly disruptive to other siblings or to family members, as I'm sure some of you may have experienced, or the child that wakes up early. And the technical definition is at least 3 nights a week for at least 3 months, and then it becomes a chronic insomnia. So we know that that is the commonest problem. There are others, but this is the commonest problem out there. And a group of experts quite recently, of which one was Professor Cortese and our own team, sort of sat together and really sort of looked at all the evidence and came up with some recommendations. And the recommendation for chronic insomnia is the first line of help should be what we think of as behavioural sleep help. That's a very broad term, but it's incorporating things like the sleep environment and how parents manage their child's bedtime routine. Those are just some little examples of the kind of things that can be helpful for children with chronic insomnia. And that those sort of approaches should be used before we jump in with any sort of medication. And I think that is something that most parents would support. So when we were thinking about, okay, we know what the problem is, we know this is very common, what do we do about it? We were very keen to engage families. This was 2 years back when we were developing our plans. So 2 of the ADHD charities, ADIS and ADHD Solutions, very helpfully disseminated a survey. Some of you may have participated in that. We had 168 families complete the survey. And it was very interesting, actually, because I was getting notifications on my email, and a lot of people were doing this in the middle of the night, which I think speaks volumes about sleep problems in families. Of the people that responded, actually 85% said their child had a problem now with chronic insomnia, and another 4% said their child had suffered chronic insomnia but was now better. So pretty much 9 out of 10 respondents had a problem. So of course, this was going to be a sample of interested parents who are more likely to have children with sleep problems, but it certainly supported that suggestion in the research literature that around 70% of these children will have some sort of sleep problem. And the ages of the children whose parents responded were, as you can see in that little colourful pie chart, most of them were school-age children. Very few were under 5s. So, you know, an important age, isn't it, in terms of children functioning well in the day and accessing education, an important time for their learning. So what sort of sleep problems were parents reporting? Well, again, this really beautifully echoed the literature. As you can see from the pie chart there, the vast majority of the children had problems falling asleep. So falling asleep was the major headline problem, but also staying asleep and waking up early were also reported quite commonly. And then the real kind of core of this, which a bit of me says we were pleased to hear it because it justifies what we're doing, but of course we're not pleased because ideally this shouldn't be happening. Parents should be receiving help. But what parents were telling us was only 58% of families, so less than 2/3 of families, had actually been offered any sort of help for their child's sleep. And in total, only about 1/3 had help that had resulted in a useful outcome. In other words, their child's sleep had got better. So of all the respondents, to sort of cut to the quick, 2/3 of families either hadn't had help or the help hadn't made a difference for them. So they were still stuck with a child with a sleep problem. So I guess what we were hearing from that sample was that provision out there was not adequate and families weren't getting the help they needed. So why is this important? You know, stating the obvious really, and I think those of you that are living this at the moment don't need to be told why this is important. One of the things I feel very strongly about as a sleep physician is sleep is never just the child's problem. You know, there are many other problems that we deal with in day-to-day life for families, but sleep is the one that very often affects everybody. It might affect the siblings who don't sleep, particularly if siblings, brothers and sisters are room sharing. And very often it will also affect the parents very directly. Their own sleep is affected. And we know that it has knock-on effects on children's well-being in the day and a burden to families and carers. And again, I don't need to tell you that, those of you who've experienced this. So, in summary, we know that in the UK, sleep problems in children with ADHD sadly are alive and well, and we have a problem, that we need to fix. So having kind of, you know, painted a doom and gloom picture, of course, there is light at the end of the tunnel and things can be better. And we have beautiful research that shows that things can be better and things can be improved for these children. And the research that we have been particularly impressed by has come from Australia, where there have been 2 large treatment trials involving several hundred children, where children were randomized. So they had a chance of either having no intervention or having a specialist intervention. And what they did in Australia was they had practitioner-delivered interventions, so either paediatricians or psychologists working with families to improve children's sleep. And the outcomes were incredibly positive. The sleep got better and lots of other things got better too. So, you know, you might say, well, why don't we just do that? That sounds great. But those of you who have been engaged in CAMHS, those of you who work with CAMHS, those of you who are waiting for your child to be seen in CAMHS will know that the NHS is incredibly stretched, and CAMHS in particular, child and adolescent mental health services in the UK are very stretched at the moment. So much as it will be lovely to replicate something like that here, in practice that will be quite difficult to deliver and importantly quite difficult to scale up. You know, there may well be services. I know there are services there are pockets of excellent services around the country. There are some charities filling the gap. But, you know, we really need something that is available for everybody. And that was where we started to explore this idea of a digital intervention. We know that digital interventions in sleep work in other fields, in other areas of child health. And certainly sleep interventions in adults have been very successful delivered this way. So this was a very appealing way of trying to offer help to many, or ideally to any families that could access it. So that was where we were starting from. So that's the why. We've done a little bit about the who because we've introduced ourselves today. We didn't introduce Ingrid Muller, who's fourth in that little line of photos. She is a health psychologist with considerable expertise, as indeed has Kate, in developing digital interventions in other areas of health. So we have a fantastic team with huge experience around developing digital interventions that work and that are effective. And as you can see from that rather long list, we have fantastic support around the country from many academics in Nottingham, Newcastle, London. We have our charity partners I'll mention in a minute. And we have some real expertise in ADHD, in psychological intervention, and in digital interventions, and also in the science of sleep. So we're very privileged to have a fantastic research team on this project. We've also got some really important partners. So this research programme is funded by the National Institute for Health and Social Care Research. And they have an organisation in Nottingham called NIHR Mindtech that is a real powerhouse of expertise around digital interventions in mental health. And they are partnering with us in this project. We also have a team who are really expert in developing online training for professionals. The Helm Group in Nottingham, I'm going to talk to them about them in a minute. We've got our wonderful charity, ADHD Foundation, ADHD Solutions, and Addis. And we've also partnered with Hampshire County Council, which is a really important partnership because we want this intervention to be accessible to as many people as possible. And we're hoping to engage foster carers in helping us to develop this intervention so that foster carers who very often look after children with ADHD, we know are also able to access this sort of material in the long term. So I've talked a bit about the why, I've talked a little bit about who we are, who the team includes, but what are we actually planning to do? I've sort of talked in a slightly nebulous way around a digital intervention and a research programme. The idea of a research programme is it's lots of little different bits of research that link up together and create a meaningful step forward in the field. So I'll talk through the different things we're aiming to do. So the first thing we're wanting to do is to really check out the evidence out there. Sometimes as clinicians and researchers, we think we know what's right, but it takes a really careful scrutiny of all the data to be confident in what we're saying. So we're going to check out what we think is the right sort of approach and the right sort of intervention for this particular group of children. And Professor Cortese has real international expertise in how you go about that. There are very special techniques we need to use to test the evidence properly. And at the end of that part of the programme, we'll have some really clear indications of what sort of interventions are likely to work for children. We really want to help professionals out in the field. Now, this may be psychiatrists, mental health workers, paediatricians. We want to help them identify sleep problems in children with ADHD. And we know from experience in CAMS that people can find screening questionnaires really helpful. Any of you whose children have been through an assessment process will know quite a big part of that is often completing questionnaires. Practitioners don't always have time in clinic to ask all the questions, so having a really quick and easy questionnaire that screens for sleep problems gets sleep on the radar of the practitioners on the front line. It avoids that problem of parents about to leave the consulting room saying, oh, and by the way, my child's got a sleep problem, or perhaps I'll talk about that next time because there wasn't time. So if it's part of a sort of routine practice, we think there's a much better chance of children getting help early. So we're developing a screening questionnaire and we're going to be looking for parents' help to do that. I'll talk about that in a minute. Importantly, we also want to support these people on the front line, so paediatricians, psychiatrists, mental health workers, to understand more about sleep. You might be surprised to know that sleep really features very, very minimally in most undergraduate and postgraduate professional curricula. So doctors, psychiatrists, paediatricians get taught very, very little about sleep. There's a lot going on nationally to improve that, But what we want to produce is some really accessible online material so that people who are day-to-day seeing children with ADHD understand about the nature of their sleep problems. Because as a professional, if there's an area you're not very confident on, you don't focus on it in a consultation. You tend to focus on the things you know. So we want to make material accessible to people in the field so they feel confident in their day-to-day practice. But what about families? What do we want to do for families? So this is where the digital intervention comes in. And the intervention self-evidently is going to be for children with ADHD. The idea is that it's a parent-mediated intervention, so it's the parent helping the child. So we're focusing on that younger pre-teenage school population. And our whole kind of mantra in this is for parents, and I would say / carers, but excuse my shorthand, parents and carers of children, but developed in partnership with parents and carers so that it's relevant to you as parents. And having developed it, we then need to trial it. You can't just make something that looks pretty and assume it's going to work. You've got to know, does this work in real life? So we're going to do a big trial of over 300 children, where children are randomized to either have the digital intervention or to have their usual treatment, which may be some treatment or no treatment, and find out what difference it makes to families' lives. And of course, at the end of the day, and we're talking here quite a long time frame, if it works, what we would like is that this is made freely available to families who have a problem. And this is how the map of all those activities works out. So the timeline is 5.5 years. So the whole project from start to finish is 5.5 years. And it started at the beginning of September. So we're still in the very early stages. We're actively underway with the evidence review. That's already happening. As you can see, developing the screening tool is happening very shortly. We've just appointed a researcher in Nottingham to start that work soon. As will the development of the online material for professionals. So Heather's going to talk to you in a minute as to how you can be involved, but the work package 2, developing the screening tool, there's 2 parts to that you can be involved in. You can be involved in helping us check out some of the screening tools that we've identified to see if they're any good, but you can also help us by your child having their sleep monitored with a little activity watch called actigraphy. And for people participating in that part of the work package, there will be the opportunity to have a little bit of a sleep report, a bit of feedback on your child's sleep. Work package 3 will be starting next year. That's developing the actual intervention, and we very much want parent participation in that project. We need to know what works for you. And then, of course, the trial, which is 2.5 years in, will need 334 families across the UK to participate. So as you can see, there's lots of steps along the way where we will really value parents as participants in the study, but also Heather will talk to you about what it might mean to be part of our panel. And right throughout all of this, we need to know how we're doing, what's working and why. And again, we're going to have parents involved in that part of our plan. So hopefully that's given you a little bit of a sort of oversight of what the project's about. I'm going to hand over now to Heather, who's going to talk to you about public and patient involvement and engagement. So over to you, Heather. Thank you.
Thanks, Kathy. Hi, everybody. There are 2 of us who are working as patient and public involvement engagement leads. My colleague Sonia Newman, who isn't with us today, but will be central to the work that you would have. Apologies, the fire alarm test has just gone. I hope that's all it is, it's a test. And myself, Heather Parsons, who I actually work at UHS, so really excited about being involved in this project. Next slide, please. Thank you. So Kathy's already explained some of the ways that you can get involved. There are 3 main strands to the way that we would love to be working alongside you, because we genuinely do need your help. So one of it will be about just staying in touch with the study and finding out what's going on. As Kathy said, it's a 5-year project, so there'll be lots happening across that time, and it would be great if you were able to stay in touch with us and tell other people about the work. You can be involved by taking part as a participant, either yourself or your child, and also you can join the advisory panel, and that's one of the things that I will talk to you about in more detail in a second. Next slide, please. So if you'd like to stay in touch with us throughout the 5 years, that would be amazing, because there'll be lots of points at which we'll be wanting to know more about what you think and how you think things are going. It might be that you just want to receive emails and find out more. The way to do that is to either use the QR code that's on the screen, or to use the link that we've put. All of these links and the QR codes will be emailed out to you after today with a copy of the recording. But we will be sending you a form, and on that form you can say that you would like to stay in touch with the study and find out what's happening and where we are with the work that we're doing. And we know that people that get engaged with our research programmes really want to hear more, and they don't like it when they've sort of heard the start of it and don't find out what happens as it moves along. So we really want to make sure that we're sending you helpful information about how the study's going and what's happening all the way through the study programme. Next slide, please. You can become a participant in the study. And again, if you want to do that, then you can sign up via the form, or you can use the QR code to get to the form. There are different ways that you can become involved, and those will change throughout the study. Kathy's mentioned that the first place that you're going to be able to become a participant is in this screening tool review, and helping us to develop that. We need 300 families to take, 300 participants to take place with that. And so it would be fantastic if that was something you felt you could get involved with. What will also happen is that 150 people will also be asked to involve their children. And that's by wearing, as Kathy says, a little activity watch, a bit like a Fitbit or an Apple Watch that you might be you might know well how they work. It's called an actigraphy, and your child would need to wear it in bed for 7 nights. And what we also are offering for people that can help us with those things is a sleep report, so you get a bit of information back about how your child is sleeping from the data that we've collected. So those are the first opportunities to either help us with the screening tool and or involve your child, so that we can start to collect some sleep data. But there will be other opportunities throughout the study for you to become involved as well. Next slide, please. One of the most important things in all of the patient and public involvement work we do is having an advisory panel that supports the study and helps the researchers, works in partnership with the researchers to really think about what is this study doing, what is the information telling us that can help parents. Oh, we've jumped backwards. And to become a parent rep on the panel. Again, we need you to sign up using the form or the QR code. And then myself or Sonia will be in touch. We'll have a chat with you, and we can talk to you about how you like to be involved. It's a national project, so sometimes we might be doing online meetings, sometimes we might be chatting to you one-to-one. There's a whole range of ways that you can become involved, but it is a panel, and so it will be important that you're prepared to share your views and opinions within a group, and make sure that you are actually helping the researchers to understand what's going on and how you think that is going to work for families with children who have ADHD and a sleep problem. We know that parents and carers are absolutely vital in this role, so we really hope that some of you will be interested to come along and work with us and take part within the advisory panel. We realise that a commitment of 5.5 years sounds daunting, so please don't worry about that. We also recognise that sometimes people will come into the project in the advisory role and sometimes they won't be able to stay. We would really want a commitment in the first instance of a few months, hopefully a year, but don't worry that you think you've got to stay for the whole 5 years. We realise that life is really busy, but commitment to an extended piece of time, like I say up to a year, would be fantastic if you thought you were able to do that. But we'll be really happy to have an individual chat with you and talk through what that would mean and how we could help you to be involved in a way that really supports you. So please feel free. We've had a parent recently who helped us look at some documents, and when they wrote back, they talked about their own personal needs about reading documents and things, and we were able to support that and help. So don't be put off by the task. Come and have a chat to us and we'll try very hard to find a way to make being on the advisory panel something you can do if it's something you're really interested in. Thanks very much. We're really looking forward to working with you, and I want to say again that this whole project is about work from parents for parents, and we know that without parents and carers we really cannot make this project work to its full potential. So we're really looking forward to working with you. Thanks everyone. Kathy, I think I'm coming back to you.
Thanks very much, Heather. Sorry to bounce, do the okey cokey with the slides there backwards and forwards. That's great, thank you. And I think I'm correct, am I not, Heather, that participation in panel work involves some payment for people's time?
It certainly does, Kathy. Thank you for reminding me. So yes, we reimburse people for sharing their lived experience in all of our patient participation work. So the panel work definitely will have reimbursement opportunities, and as I say, we think most of the activity will be digital, so we reimburse you for the time that you spend with us and give a small contribution to your data use as well.